All right. Hello, everybody. Dr. Rafich here, board certified surgeon, owner of Vet Triage. Um, we will talk today about heart murmurs and a place like Thrive, which Vet Triage is partnered with numerous Thrive facilities, is an example of a vet hospital that your dog or cat may go in and be found to have a heart murmur. And there were no clinical signs, so no symptoms associated with this diagnosis. Your vet just happened to auscult the heart with their stethoscope and heard a murmur. So, what do you do about it? What should be done about it? What causes it? All that stuff. We'll go into it here briefly. And if folks jump in to the live chat, and great. If not, it's fine. This is another very common disease in small animal medicine, and I have no doubt it'll come up many times in the future as well. So it's clear cut, but for some reason there is a lack of consistency on the ground in clinical practice regarding how to handle heart murmurs. So let's talk about it now so that you're best equipped. The heart murmur, by definition, implies an abnormal sound that is usually due to leaky valves in the heart. However, any cardiac defect, not just the valves, but any part of the heart that is abnormal, that is causing a disturbance in blood flow in the heart, will cause an abnormal heart sound. So when the doctor listens to your pet's chest, they're listening for normal heartbeats. It should be there should be no arrhythmias. It should be consistent. And a murmur is described as a whooshing sound, and that whooshing is the sound of the change in velocity of blood flow as it's trying to traverse the abnormality in the anatomy of the heart. So you can think about it like a garden hose. When the garden hose is on and the flow of water is uninterrupted, it just flows. And if you put your thumb over part of the end of the garden hose, it'll cause the water to spray in different directions, and that's the equivalent of a heart murmur, something like that. Okay, so it's an abnormal sound. What does it mean? Well, there's two broad categories, let's say, of heart murmurs, like really broad. One is what we call the innocent murmur, which you can hear normally in animals, like especially juveniles, immature animals, so puppies and kittens. Because of their normal physiology, usually they've got some level of anemia in comparison to an adult, but there may be other factors too, and so you have an innocent murmur, which implies that the murmur is found in a young animal, so meaning under the age of adulthood, which on average 12 months old. So anytime before 12 months. And also the innocent murmur is expected to resolve on its own spontaneously as they hit adulthood and beyond. So that's what we term as an innocent murmur. It's innocent because we don't suspect any pathology or any sequela from it. There's a murmur, and hopefully they'll grow out of it. Then the second category of heart murmurs is the more common one, the more concerning one, which is cardiac pathology. There's something wrong with the heart that's causing the heart murmur. And if you want to add in there a third category that is unrelated to abnormal cardiac anatomy and blame it on other pathologic processes outside the heart, like I had mentioned, anemia in younger animals. Well, if you're an adult animal and you're affected by anemia, then that can also cause heart murmur. For example, other conditions like hyperthyroidism can do it. So there's extra cardiac conditions that can cause it. It can cause a murmur. But in general, our discussion here will be focused on cardiac conditions specifically, and those that are not innocent murmurs. So that's the more common scenario, and that's what most people will need to know about. So when the veterinarian hears a murmur in your dog or cat, that implies a structural abnormality in the heart that may or may not have downstream effects affecting the longevity and quality of life of that pet. So we need to get it figured out. A heart murmur in itself is not a diagnosis. It's still a clinical sign, or rather it's a physical exam finding it's abnormal. And you still need to find out what's causing the murmur. And most often murmurs are caused by valvular disease, and most often the valvular disease is the mitral valve in the heart. So, but you have to diagnose that, and so the only way to figure out what's causing a murmur is with cardiac ultrasound. It's called an echocardiogram, or an echo for short, ECHO. And the difficulties with echocardiograms is that it takes a specialized skill set as an ultrasonographer to perform it. Not every doctor who knows how to operate ultrasound is certified or confident enough to perform a cardiac ultrasound. So it's hard to find those doctors. And then it can be a bit costly, depending on where you live in the country and how much they want to charge. $600, $800 for an echocardiogram. So it can be a bit pricey, but well worth it. Well worth it if you can swing it, if you can afford that, to look at your pet's heart and to find out what is causing the murmur. And then from there, depending on the cause, they can decipher, okay, what are the cause or causes of this murmur? What's the prognosis long term? What kind of monitoring do we have to do from there? Do we have to start medications, right? The concern with heart murmurs long term, should it be progressive and should it go untreated, is that you can develop secondary congestive heart failure. So the heart can eventually fail because of the abnormalities in the blood flow. And so the first step when you're diagnosing the murmur is an echocardiogram. Now, having said that, those who have had history with this and those who are medically trained will say, well, what about x-rays of the chest? So thoracic radiographs of the chest, why not perform that first? And most vets do, actually, because radiographs, x-rays, are much more commonplace and easier to access and more affordable than an echocardiogram is. And because performing thoracic radiographs allows you to not only look at the heart, but also look at the lungs and surrounding tissues in the chest cavity, most of us, if not all of us, will perform a thoracic radiographs first. And I recommend you have to at least collect 2 views, so at least a lateral and a VD. Ideally 3 view chest rad, so right lateral, left lateral, and a VD. VD, for those who don't know, is ventrodorsal. And especially in your middle-aged to older pets that are prone to other diseases that can cause clinical signs associated with that mimic heart disease. So 3 view chest rads, ideally 2 view if that's how you were trained, or if the patient is on the younger side, that's fine. And if you have a patient who's struggling to breathe while you're trying to collect the radiographs, then you can replace the ventrodorsal view with a dorsal ventral view, so a DV instead of a VD. Not as good, not as accurate, but still better than nothing to get that 3rd view. But really, if you had to pick one view because the patient is so compromised, cardiovascularly speaking, then a lateral view would be most beneficial. The lateral view at least gets you to look at the cardiac silhouette and look for signs of congestive heart failure in this example of cardiac cases, like pulmonary edema, pleural effusion. Okay, so most veterinarians will perform thoracic radiographs when they diagnose a heart murmur to rule out heart failure, to rule out other things in the chest, and it's a stepping stone to get you to the echocardiogram. If there's evidence of cardiomegaly, which is an enlarged heart on the thoracic radiographs, evidence of heart failure on the x-rays, then your vet will start treatment even before the echocardiogram is done, because the echocardiogram could take days, weeks, or months to get performed, depending on where you live in the world. And so you don't want to leave this patient untreated, especially if they have active congestive heart failure or concerns on radiographs that even though we're not in heart failure now, it could progress to that. So they'll start treatments, and those treatments can be a combination of diuretics and heart contractility strengtheners, oxygen therapy, whatever, a bunch of stuff. I will of course plug Vet Triage if you're in a situation where you're trying to figure out why the doctor gave you medications, how can you modify the drugs because your pet's having trouble but your vet's not available. You want to just learn more about the drugs that your vet gave you. You want to learn more about this condition, go to vettriage.com, meet with our veterinarians, and they're all proficient in cardiac disease. So chest x-rays are first line of defense. Then hopefully eventually you can get an echocardiogram done, which will give you more of a long-term plan for this heart. Now you may ask, well, why would I perform an echocardiogram if you said that the radiographs can show me the structure of the heart? Well, two different things. The radiographs cannot show you, in the vast majority of cases, the internal structure, the detail of the heart that echocardiogram can. So these two tests are synergistic. The same way the echocardiogram is not the best tool to diagnose congestive heart failure, whereas radiographs are overall a better tool to diagnose heart failure. So you really want both diagnostics because they are synergistic, but the radiographs does not replace the echocardiogram, and vice versa. If I had to pick one of those two, it would depend on the scenario. Because if your dog or cat is actively having difficulty breathing because of heart disease, well, the x-rays are way more important than it's an emergency setting. You need x-rays right now. But if you're not in that scenario and the pet has no clinical signs, but the heart murmur has been diagnosed, then yeah, the echocardiogram is preferred to give you more detail. So it's up to the doctor's judgment of the case and what's available to you. Okay, and then finally, the third test is going to be an electrocardiogram, which is an ECG. Electrocardiogram tests evaluates the electrical conductance of the heart, and there's variations with that we won't go into. The only thing I'm going to remind you is that the only reason why you would have an electrocardiogram or an ECG is to be thorough with the cardiac evaluation. With heart murmurs, because it's a structural problem, you expect to see an abnormal anatomy to the heart, which is what the echocardiogram is for. The ECG can't tell you that. What the ECG can tell you is there an abnormal electrical conductance to the heart, which is typically like, a different category of disease. So do you need an ECG when you have a dog or a cat with a heart murmur? No, you don't. But if you want to be thorough about it, you really should. You can have a structural change to the heart that is one problem, but then it causes electrical disturbance secondarily, right? Because the heart size changes, the electricity going through that helps with cardiac functionality is going to be altered abnormally. So an ECG is an important test. For other cardiac conditions, it's way more important. For this, it's more of a supplementary diagnostic that just adds to the overall picture. And then there's other tests, of course, that can contribute to this that your doctor will decide. But blood pressure monitoring is very important. Oxygen monitoring is very important. Your baseline blood work, so a biochemistry panel or a chemistry panel or a chem is vital. A complete blood count or a CBC also important. So there's other tests, of course, that you'd want to look into, and you can go as far as to find studies that look at computed tomography, so CT of the chest. You can look at magnetic resonance imaging or MRI of the chest as well. You're getting a bit fancier now and less practical, more advanced than what we're talking about here. But the vast majority of these cases, you find the heart murmur, you say, okay, if you want to work this heart murmur up, we need to start with some thoracic radiographs, schedule an echocardiogram, collect an ECG, blood pressure, pulse oximetry for the oxygen values up to your vet, and then from there decide prognosis, treatment, follow-up. And again, the treatments vary, and I'm not going to go into those because that's very specific to your own case. And I prefer you talk to an established veterinarian in person or vettriage.com to get more information on the specifics of your questions with your case. So that's heart murmurs in general. Hopefully you're able to follow it. I do have I believe a video on my platform on my YouTube channel that is from a podcast that I used to do about heart murmurs. I'm pretty sure it's in there. The most common reason why veterinarians want to have diagnostics performed for heart murmurs because every pet needs dental work, dentistries, and most pets, on average, most pets need dental work done once a year to get their teeth cleaned. And unlike in people where we can perform teeth cleanings without anesthesia or sedation, you can't do that with animals. They won't sit through the scaling process and polishing. It's going to be like a 45-minute long procedure or longer. And so they need to be under general anesthesia. And because of that, if you have a newly diagnosed heart murmur or a history of heart murmur or heart disease, then you want to work that patient up to make sure that patient can or cannot handle the fluid therapy that they're going to receive during the procedure, the dental procedure, and make sure they can handle the anesthesia from the dental procedure as well. And so a lot of times, if the murmur is not found previously, you'll go to a new vet. They'll say, "Hey, has anyone ever told you your dog's got a murmur?" And you'll say, "No, no, he had an exam last year, and there was no evidence of that." All right, well, he's got a murmur now, and they can develop that over time. And so here's what this means: we really shouldn't have the dental done until we can work up the heart, until you guys can have that conversation about that. So that's just a common scenario, but there's many other scenarios, of course, but that's a common one. All right, well, I think I'll end this here. If any questions at all, leave it in the comment section or whatever, and feel free to spread the word on this channel. Hopefully, we'll start getting audiences here in the future for live streams. Feel free to donate, support what we're trying to do here, vettriage.com. And thanks for to Thrive as well for partnering with Vet Triage, and hopefully we can work with more of your hospitals in the ongoing future. Everybody take care. We'll see you in the next one.